Do you believe debt collectors have control over a significant portion of our medical debt? A study from 2016 placed the cost at $81 billion, but fresh data shows that figure is significantly wrong. A study published in JAMA on Tuesday looked at 10% of all credit reports from TransUnion and found that roughly 1 in 5 Americans, 17.8%, had medical debt in collections in June 2020, totaling $140 billion. Our data reveals that more than half of the time now, when you think about financial distress, debt collectors phoning and pounding on doors of households about its medical debt, says lead author Neil Mahoney of Stanford. That's a very beautiful and particularly American phenomena. On the shocking front, according to a Stanford article on the report, medical debt is not just the most commonly collected debt, it also outnumbers debt collected from credit cards, utilities, auto loans, and other sources combined. And it's likely that the true amount of medical debt is larger, since Mahoney points out that his calculation excludes medical charges purchased using a credit card, which would be classified as credit card debt in collections if someone defaults. According to the most extensive research on the virus's devastation in the South Asian country, India's excess deaths during the pandemic could be a startling 10 times the official COVID-19 toll, likely making it contemporary India's worst human disaster. According to the Associated Press, most analysts believe India's official death toll of over 414,000 is significantly undercounted, but the government dismisses such fears as overblown and misleading. Between January 2020 and June 2021, excess deaths, the difference between those recorded and those expected, were anticipated to reach 3 million to 4.7 million, according to a research issued Tuesday. That would surpass the number of people killed during the 1947 partition of the British-ruled Indian subcontinent into independent India and Pakistan, which resulted in the deaths of up to 1 million people as Hindu and Muslim gangs slaughtered one another. A precise total may remain tricky, according to the report, but the exact death toll is likely to be an order of magnitude more than the official tally. Arvind Subramanian, the former chief economic advisor to the Indian government, and 2 other scholars from the Center for Global Development and Harvard University collaborated on the report. The official tally could have missed deaths that happened in overcrowded hospitals or when healthcare was impeded, especially during the catastrophic virus outbreak earlier this year, according to the report. Researchers compared mortality data from past years to deaths from all causes, an approach usually regarded as a reliable metric. On them. According to the New York Times, the researchers discovered that Medicaid expansion had an ameliorating effect on people who were affected. In 2020, Americans living in states that did not expand Medicaid owed an average of $375 more than those living in states that did, about a 30% rise from the gap that existed the year before implementation, according to the Times.